Good day, everyone. I'm Trinette Sofia Cruz, student nurse from Marichel's College, and today I'm going to be performing the intradermal skin test. The purpose of this procedure is to provide a medication that the client requires allergy reaction and TB screening. So the first thing that we're gonna do is to assess the area of injection site and then assess the drug action and the expected response, and also assess the client's knowledge to the drug reaction. For the preparation, we have to prepare all the equipments and supplies. First is the MAR or the medication administration record, ampule or vial, but I'm gonna use a vial, tuberculin syringe with a gauge of 25, alcohol swab, gauze, non-sterile gloves, and band-aid if necessary. If available. We have to carefully check against the MAR to ensure that this is the right medication being prepared. Always remember to follow the 3 administration medication checks, which are the read the label of the medication when it is taken from the medication card, before withdrawing the medication, and after withdrawing the medication. Once that it was all done, organize all the equipment. Now that we're going to use a vial, we have to roll the solution between our palms, not by shaking. And then, after that, we're going to cleanse the rubber cup of the vial by using an alcohol swab in a circular motion. And then we're gonna withdraw the right amount of medication here to the vial. ml. So, pag ganon, pabalik natin yung syringe and kunin natin yung right amount ng medication. So, the first thing that we're gonna do in the procedure is to sanitize our hands by using an alcohol and observe other appropriate infection control procedures. Now, for the implementation, we're gonna introduce ourselves to the client. So, hi, I'm Trinette Cruz, your student nurse for today. And verify the 2 identifiers to ensure that the right patient receives the medication. So the next thing that we're gonna do is we will explain to the client that the medication will produce a small wheal, or sometimes called a bleb. So magkakaroon lang po ng small na bilog sa inyong arm na may pagkasakit, pero kailangan po namin gawin for the skin test. Information can facilitate acceptance of and compliance with the therapy. In selecting the clean site, avoid using the site that has swollen, inflamed, tender, and those that have lesions. So we're gonna use this on the cubital part of her body. So the first thing that we're gonna do is to put on the gloves. So now that we have put on our gloves, I'm gonna use the taba or yung baboy, kasi hindi pa ako marunong sa tao, baka maano ko lang. Ayan. Cleanse the skin at the site using a firm circular motion, starting at the center and widening the circle outward. So, ayan. So, and then allow the area to dry thoroughly. While waiting for the skin to dry, remove the needle of the cap. Remove the needle cap pala. So, expel any air bubbles from the syringe because a small amount of air will not harm the tissue. So, kailangan natin siyang i-stretch. Okay, ganyan. Galing siya sa freezer, kaya medyo matigas siya. Yan. Basta dapat, hindi ko siya ma-pinch, kasi, kailangan pala bevel up. So, So, again, bevel up. There. Grasp the syringe in your dominant hand, holding it between thumb and forefinger. Hold the needle almost parallel to the skin surface. With the bevel needle up. So, there. The possibility of the medication entering the subcutaneous tissue increases when using an angle greater than 15 degrees. So, inject the fluid. We're gonna inject the fluid. With the non-dominant hand, pull the skin at the site until it is taut. Taut skin allows for easier entry of the needle and less. There. Insert the tip of the needle far enough to place the bevel through the epidermis into the dermis, 10 to 15 degrees. The outline of the bevel should be visible under the skin surface. So, kailangan visible siya sa skin surface. Then, stabilize the syringe and needle and inject the medication carefully and slowly so that it produces a small wheal on the skin. This verifies that the medication entered dermis. So, there. Since we don't have a band-aid, then hindi siya available. Do not massage the area because massage can disperse the medication into the tissue or out through the needle insertion. Dispose the syringe and needle safely. Do not recap the needle in order to prevent needle stick injuries. And remove the gloves. And encircle the injection site with blue or black to observe for redness or induration per agency protocol. So, since ayaw gumana ng ballpen sa ayaw din basta ko encircle the area, the injection site. Evaluate the client's response to the the testing substance, because some medications that is used may cause allergic reactions, and it is need to use an epinephrine. Evaluate the condition of the site in 24 to 48 hours depending on the test, and measure the area of redness and induration in milliliters in the largest diameter. And lastly, document the findings.